right, it's 19 minutes after the hour of 6 o'clock. Good morning, good morning, good morning to all of you, and welcome to the Spotlight. In today's Spotlight, clinical psychologist Dr. Katija Khan to just talk to us about how these children have fared over the last 2 years, especially now that they're back into the physical classrooms from forms 4 to 6. What has that looked like? Good morning to you, Dr. Khan.
Good morning, Natalie. Good morning to everyone.
And thank you so much for being with us here this morning. So, Doc, the children are back out to school, well, at least for forms 4 to 6 in the physical form. They're back into the physical classrooms. And already we've had, you know, a few reports, or 1 or 2 reports of fights, and we've definitely seen a lap dance and, of course, 1 and 2 COVID cases. So I'm trying to figure out, now that we know we have to try to live with COVID-19, and these children are back into this physical space, what do you think would be the best approach to reintegrating them? Because I literally feel as if 2 years out of the classroom and coming back, that there should have been a kind of an initiation process.
Very much so. You're spot on. First, let's establish something. The return to school is a positive thing. For many, many months, globally, all of the experts and professionals have indicated that it is in children's best interests to have a return to school as soon as possible. That online schooling was never meant to be a substitute for either in-school experience or a homeschool experience. So it is a good thing that children are having the opportunity to return to school. Now, that said, you're quite right. Having been out of school for so long, that would have had an impact. Children's mental health, their socio-emotional functioning, their social skills, the things that they were subject to, and the impact of the pandemic, we have to take that into consideration now into this transition back to in-person schooling. And also, the things that you mentioned, we know that pre-pandemic, there were challenges that we faced in schools. So whether it's a behavioral issue or conduct issue, we always had these challenges. And the absence from school would have exacerbated some of them. So certainly thinking about how we transition children back into school, what measures we need to take and what we need to put in place is a very important step.
What do you think are some of those things that we should have done, though, before we reintroduce them to the classrooms?
Well, one of the things that online schooling made it difficult to do was for teachers to be able to monitor children, to identify the children who may be at risk, who may be having more challenges, who may need additional support. So I think that's one of the things we need to do. Check in with children and see what they're going through. What is their home situation like? If you have a child coming from a home that has been impacted severely by this pandemic, so that family is going through economic hardship and there's a lot of parental stress, that is going to have an impact on the child and their functioning in the classroom. And we're talking of the different levels, cognitively, their learning outcomes, etc. So I think we need to have a process before we just resume school as normal, that there's also a part of that process where we check in to see where children are, and if we're seeing some issues, if we're seeing more conduct issues, more behavioral issues, then we need to figure out what's the best way to address that. Now, I think many teachers and many schools are trying their best, because many schools are still grappling with delivering in person as well as managing virtual, and many teachers are also adjusting to that transition themselves. So I think all around we need to recognize, well, what are the challenges we are facing and what's a proactive way to help both teachers and the school management and also the children adjust healthily.
And you're right. I think we have recognized this since the pandemic, that there's so much that we can and probably need to do differently when it comes on to education, because the adjustment, a lot of times we speak about the students, but the adjustment was literally for everybody. You had parents who didn't know their children, didn't know how to communicate with them because they've never spent so much time with them before. But some of the things that we've seen since the physical schools reopened, we had even before the pandemic. So what does it tell us about the students in terms of their behaviors and how they act out or react to things. Are we having some kind of disconnect between, you know, what's happening in the homes, what's happening in the schools, and what we're seeing being played out physically, like a lap dance in a classroom?
Well, I think, as you mentioned, it's always been a challenge. And so we would have struggled to deal with it prior to the pandemic, and continues to be a concern during the pandemic and post pandemic. So when we're looking, there are certain behaviors that are developmentally typical. So if we have children who are struggling to pay attention, or maybe they're being a little rebellious to authority, some of that we can characterize as being developmentally appropriate for teenagers and adolescents. But behavior that you are speaking about there goes beyond that. So this, now we're talking about problematic behavior. So I think there needs to be many steps that are taken. So we have to look at it in terms of a preventative approach. So what support can we also give to parents? When that issue comes up, how is it handled in the school, and what support network needs to be recruited? So do we need to involve a school social worker? Does that child need to be, and they should be referred for some help, some counseling, some assistance that may go beyond that initial school framework of, say, the teacher or the dean or the principal. We also need to see signs like these, not just as misconduct and misbehavior, but it's a sign that there is an issue and there's a problem. So here we have some children who are demonstrating poor judgment, and perhaps some impulsivity and some inappropriate behavior. So what do we need to put into place to help them make better judgments, to help them regulate their behavior more? Is this also a sign that a child may be exposed to elements that may be abusive as well? Because sometimes children emulate things that they witness. And I'm not speaking about any particular case, because I have no details on those cases. So let me just give that caveat. But I'm saying that when we see behaviors like this, we want to do a little bit more of a deep dive and recognize that this family and this child and these children may need support, and not just the child, not just the girls in the video, but all of the children in the video, including the young boys as well. But we also need to think about this as a reflection of society. What in our society is supporting this behavior? If I draw another parallel, Natalie, when the SEA results came out, when the CAPE results come out, CSEC results come out, we, and deservedly so, laud the high achievers, and they should be commended for their top achievement and their hard work. But what about all of the students who are not achieving, the ones who are failing, the ones who are falling behind? Are we equally as concerned about them from a societal level, or do we just now say, well, it's those families and those parents and those children, that's their problem and their fault for not achieving? So I think if we characterize underachievement and certain kinds of these social behaviors and misconduct in schools as a societal problem, that will also give us a key about how we need to address them.
I definitely agree with you, but what is it you think stops us from, looking at it like that, to say, okay, instead of just dismissing something and saying, okay, that's a bad child, or, that's just awful behavior, that we recognize that there might be something else at play, and that as a society, our approach, just the way we see it and just the way we deal with it, can make a difference to what we see over time, even if not today, 10 years from now, 15 years from now, that our response to situations can change the situation themselves.
I think two things. So one, how we attribute causes to things, so the reasons we ascribe to things. So I think that sometimes we are very personal and individual. So my success is my hard work, and I don't think about all the other opportunities and the framework and the infrastructure that were in place to help me achieve that success. And it's the same thing for children who are struggling. So we don't pay enough attention to the fact that exposure to childhood trauma, having adverse childhood experiences, like economic hardship, exposure to any kind of abuse, having domestic violence in the homes. Those have a very significant impact not just on children, but well into adulthood on both our physical and mental health. So if we recognize, if we start to view these things as something of pertinence for the society, then that's where we need to target our interventions. So when we realize that this one video of one set of behavior in a school is not just that school's problem and that family or that child's problem, that's just the one video that made it into the public domain. We know that these problems exist. So what programs and interventions do we have in place for children to help aid that pro-social behavior, to help them make better choices? So for example, the police youth clubs are a fantastic initiative for children, and the pandemic would have affected children's access to that. School clubs and extracurricular activities to help them be engaged in productive activities. We need to understand how all of these elements of the education system fit together to help raise the kind of children that all of society can own and say we're creating better citizens for tomorrow.
Do you think we're aware, though, Doc, that there are correlations between, what we're seeing, the kind of behaviors that we see from students and, our circumstances, whether it's economic, whether it's social, whether it's environmental?
There is a very strong correlation. So we do know that children who undergo more of what we call these adverse childhood experiences, it has an impact on their development, their physical and mental health, their educational outcomes, their educational achievements. And the converse is true as well, that if we offer children more positive childhood experiences, that they will benefit from these. And the positive childhood experiences are not only at the individual level within the family. We know that when children have supportive adults outside of their family, somebody that they could rely on, that they could talk to, that it helps. If they have teachers that they see in that view, if they feel a sense of belongingness in their school and in their community. So what we are seeing then is a role for everyone. So that old proverb that it takes a village is very true. Even in 2021, and the village in this case is our entire society. So when we realize that a particular community is more affected by economic hardship or violence or gender-based violence, then our response to that is not to point a finger and say, well, that's how they are and they don't know any better, etc. Even more so now, we need to devote more resources and have more interventions to tackle that problem at all levels. So the prevention, and then when it occurs, when we've identified that this problem is existing, what interventions do we provide for the children and the families that are involved, and how do we follow up and monitor so that they don't fall back through the gap? A year from now, we don't hear about them, they're no longer in the system, etc. So we really have to take this whole person approach, look at how this affects children, and when we understand that the problem that we ignore and deny today is still going to be there 20 years from now, and probably even worse and at a greater magnitude. So early intervention and prevention is always a better strategy than hoping for the best.
Yeah, you know what, Doc? I think we have seen over the years a lot of systems put in place to try to address these things. I don't know if something is amiss somewhere along the line, but we've seen the MyLet and MyPad programs. We've seen so many things to deal with children who have supposedly fallen by the wayside, to give them a space where they can learn, where they can be a part of something, where they can feel included. I remember even last year, July, after that violent protest, we saw, the Prime Minister put together a committee to go in, speak to the communities, speak to the residents to find out, what is the issue, what are the issues, how do they get resolved. So I think we've seen over the years, real attempts to treat with the issue, but still it's something that plagues us. So what if you had to make an educated guess, what are the missing elements?
You said a key word, Natalie. You said that there have been attempts, and there have been attempts, and some of these have been shorter stopgap attempts, and some of these have been longer ongoing attempts. But I think one thing that we definitely need more of is more monitoring and evaluation of these programs and interventions to determine whether they are indeed effective. Just because we have done something, that does not guarantee that it's been effective. How do we know? What were the outcomes and the indicators to tell us that this is a success and therefore it's worth investing more money in, or it's worth expanding and rolling out or
Yeah.
upscaling? So, yes, we have had attempts at interventions. Yes, we've had interventions, but which are the successful ones? Which are the evidence based ones? Which ones will work in a certain community and which ones will work better in another community? And that, I think, is where some of our gaps are. That we do these initiatives, we roll them out, we implement them, but we do not have the evidence and the data to support to make decisions about which ones we need to discontinue, which ones we need to support more and expand and roll out.
And the pandemic just made things worse because, as I said, now you have parents who had to literally learn who their children are. Now we have children who had to interact with parents who they didn't know before. We have teachers who would have been trying who probably isn't in a position to because their parents too. I mean, there are so many moving parts with the pandemic that could even, just change even the little strides that we've made over the years. So do you believe that we're even now, as we go back to the physical classrooms, as we get that, I wouldn't even say reintegration, but as we literally go back to the physical classrooms, that there's an opportunity again for us to say, okay, let's go back to the drawing board. Let's see, where we need to pick up, what we need to look at, having some kind of data about how the pandemic would have affected us, what it is that we need to do now.
Definitely, we need to, well, first let me reiterate that the return to school is a positive thing, and I look forward to that being expanded to all of the school-aged children, because we know that the absence of that opportunity, even if we look at preschool children who would have been denied some of those opportunities for early learning. So if we start from there and then we go up through the ages, children with special needs, children who have learning disabilities, being out of school would have made it harder for teachers to help identify and flag who these children are, to refer them for more assessment, for more support. For children who were in homes where they are at risk for violence and abuse, being out of school would have exacerbated that.
Yeah.
As I mentioned before, students in homes with economic hardship and parental stress, that is going to have an impact on the child's mental health as well. So coming out of all of this, we need to get an understanding of where our children are, not just academically and cognitively, but emotionally, psychologically, and what additional steps can we take. And this is not to say we're adding more on the plates of teachers who already have such a significant role and responsibility, but how those approaches can be integrated into what they're already doing. So sometimes even just a check-in with children, sometimes that parent-teacher communication is important, so parents can flag if there's an issue at home that is likely to affect the child. There are so many of our students are still undergoing online schooling, and many households are affected by poor internet connectivity, a lack of internet access, a lack of device access, and the concern is that the longer that this happens, that some of those gaps they won't be able to catch up. So the sooner that we could return children to a normal, what's normal these days, but we can reintegrate them into the school environment and give them the support, that's going to be better.
Dr. Khan, I want to thank you so much for speaking with us this morning, and I'm really hoping that somewhere somebody's listening and will recognize that things have gotten worse since the pandemic, and that we need to get back to the drawing board and see how we can help these children, because they're ours, and we have to determine the kind of society we want to see 10, 15 years down the road. But thank you so much. You're most welcome, Dr. Katija Khan, they're a clinical psychologist. And no surprise that the pandemic would have made things a lot more difficult for the students. And she says we need to check in with them, not just to see where they are academically, but mentally, emotionally. Because what we're seeing now, we had those issues even before. Imagine after the pandemic.
Yeah, it's just going to get worse. What I really appreciated from what she said just now was the measuring and evaluation of the systems that we set up.
Yeah.
That part is critical because we
Sounds
can't
like
just
a
keep
conversation we had yesterday.
Yeah, we can't keep reinventing the wheel and then thinking we're making a difference. We have to actually measure what that difference is.
Yeah. All right. We take a break and we'll be back with more. Stay with us.
I know you don't want no sermon, but my admonition is to